It's time for the 420 Radio News, covering the latest headlines in consumer cannabis, medical marijuana, and industrial hemp. Transcripts of 420 Radio News are available daily on our website at 420radio.org. Now, here's Russ Belville with your marijuana headlines in 4 minutes and 20 seconds.
This is your 420 Radio News for Monday, January 26, 2015. The American Academy of Pediatrics has issued major changes to its policies regarding marijuana. The nation's largest group of doctors specializing in children's health recommended that marijuana be decriminalized, but that states should be wary of full commercial legalization. The pediatrician's stance is that marijuana use among young people is a public health issue rather than a criminal justice issue, and it should be treated as such. However, efforts to fully legalize marijuana should be slow and moderate, according to the group. Dr. Seth Ammerman, a pediatrician at Stanford University who wrote the policy paper, said if marijuana companies start marketing their products like alcohol and tobacco companies, the kids and teens could be affected. The pediatricians also called for cannabis to be moved out of Schedule 1, where it is deemed to have no medical value, frustrating legitimate efforts to research it. Legal marijuana is the fastest growing industry in the United States, and if the trend toward legalization spreads to all 50 states, marijuana could be larger than the organic food industry. Researchers from the ArcView Group, a cannabis industry investment and research firm based in Oakland, California, found that the U.S. market for legal cannabis grew 74% in 2014 to $2.7 billion, up from $1.5 billion in 2013. The group surveyed hundreds of medical and recreational marijuana retailers in states where sales are legal, as well as ancillary business operators and independent cultivators of the plant over the course of 7 months between 2013 and 2014. ArcView also compiled data from state agencies, nonprofit organizations, and private companies in the marijuana industry for a more complete look at the marketplace. Over the next 5 years, ArcView predicts that 14 more states will legalize recreational marijuana and 2 more states will legalize medical marijuana. The Pinoleville Pomo Nation in Northern California's Mendocino County is set to be the first tribe to grow and manufacture medical marijuana on tribal land. The tribe has inked a deal to develop an indoor grow facility in its rancheria north of Ukiah. Foxberry Farms, a subsidiary of the Kansas-based firm, which partners with tribes on economic development and projects ranging from farms to casinos, will help develop the state-of-the-art greenhouses as well as processing and office space. The operation will sell marijuana only for authorized medical users and dispensaries in accordance with California state law. Many anticipate California to join at least 4 other states in legalizing recreational use of marijuana next year. Foxberry has pledged $30 million to develop at least 3 medical marijuana facilities on tribal lands in northern, central, and southern California. Industrial hemp farming may also come into play in the future. Florida medical physicians would be allowed to prescribe medical-grade marijuana to needy patients under a major cannabis bill filed Monday by a top Florida Republican state senator. The legislation proposed by St. Petersburg Senator Jeff Brandes would allow people who have specified serious medical conditions, such as cancer, AIDS, or epilepsy, to receive and use medical marijuana if a doctor certifies its use. Patients would be limited to a 30-day supply. But the bill goes a step further and says that doctors could certify medical marijuana use for other patients who have exhausted other medical treatments first. The legislation is the most far-reaching of its kind proposed by a top Republican and reflects a proposed constitutional amendment that garnered 57.6% of the vote. That amendment, which failed because it didn't meet a 60% threshold for approval, has been redrafted and could appear on the 2016 ballot. More than any prior year, it appears that 2015 will be the year medical marijuana comes to Pennsylvania. A supportive governor has taken office along with new leadership in both chambers of the General Assembly. Last year, House Speaker Mike Turzai, a Republican from Allegheny, opposed the medical marijuana bill, saying that legalization should come down from the federal level. Medical marijuana could have a clearer path now that the new majority leader is David Reed, a Republican from Indiana, a co-sponsor of the House version of the bill. Governor Tom Wolf, meanwhile, publicly supported legalization on the campaign trail, a reversal from the position of former Governor Tom Corbett. Political analysts say the medical marijuana could provide a much-needed early victory for the Wolf administration. Supporters have been ramping up outreach in anticipation for the bill's reintroduction, which is now named Senate Bill 3. This has been your 420 Radio News for Monday, January 26, 2015. I'm Russ Belville.